Welcome to our virtual town hall panel. I believe this is our 9th that we have held since the COVID-19 outbreak began. And so we are glad to be here. This panel is being sponsored by the City of Steamboat Springs and Routt County in partnership with the Steamboat Pilot in Today. My name is Lisa Slitchman and I'm the editor of the newspaper, and I'll be moderating today. Today's panel, as you can tell, is truly virtual. We're all participating through Zoom. And we think it's more important than ever that people are staying at home as much as possible. And so we are modeling that by us doing this remotely. I also encourage everyone to also wear masks when they're out because it's going to take all of us to flatten the curve and get us on the other side of this. So I want to thank our panelists. They're all very busy people, and so we appreciate your time this morning. I'll begin, and if you would just want to, I don't know if people will see, but if you'd wave when I say your name. So Sonia Fiddler, President of UCHealth, Yampa Valley Medical Center. We have Steamboat Springs Deputy Fire Chief, Chuck Cerasoli. Dr. Jesse Sandhu with the Steamboat Emergency Center, and Dr. Jennifer Kempers with Yampa Valley Medical Associates. Great. Thank you all very much. So I'm going to begin with a general question and allow you guys to kind of introduce yourselves to all those that are watching. So Jennifer, let's start with you. Please tell our audience the role that you play at your organization and how you are involved in the COVID-19 response for our community.
Okay, hello, I'm Jennifer Kempers. I'm an internal medicine physician here in Steamboat. My family and I moved here in 2003. I've been on hospital leadership since for the last 15 years. I am the chair of the Medicine Critical Care Service Line at the hospital. And most recently have put on another hat, which is working with Chuck Cerasoli in the county, being the medical liaison on alternative care sites, should those arise.
Thank you, Jennifer. Next, Sonia, would you please introduce yourself to our audience?
Yeah, hi everyone. As Lisa said, my name is Sonia Fiddler. I am the president here at Yampa Valley, UCHealth, Yampa Valley Medical Center. You know, since we heard the first cases of the virus, we initiated dialogue planning for preparation. As the community's level 3 trauma center and full service hospital, we've been working around the clock for the past month specifically in regards to just developing plans, appropriate policies and procedures, how to respond to this pandemic while ensuring that the health, safety, and wellness of our staff, our providers, and our patients are continue to be our priority.
Thank you. Chuck, please explain your role and who you are.
Thanks, Lisa. My name is Chuck Cerasoli. I am the Deputy Fire Chief with Steamboat Springs Fire Rescue, and right now I'm acting as the interim fire chief while our fire chief is out. And so I've been working very hard on that side of things with the fire department to make sure we're prepared. Also, I work very closely with the Emergency Operations Center, which was stood up a while ago. I don't know the exact date, but over a month ago, we initiated a virtual stand-up, and then we've been stood up and operating every day for quite some time. And through the policy advisement of local leadership, through the county commissioners and city council members, as well as other policy group holders, they asked us to focus on a surge plan specifically. And so we formed a task force through the EOC. So we have many members on that task force that have been working for the last couple of weeks quite a bit on trying to set up a plan if the hospital hit their capacity, and then we was trying to figure out a way to help them decompress some of their patients to allow them to continue to take critical patients into the hospital. And so that's been our focus, and I've been working with that task group along with Dr. Kempers and others for a while now.
Thank you very much. Jesse, how about you? Could you explain your role at Steamboat ER and then with COVID-19 response?
Absolutely. So I am one of the physician owners. We have a team of a total of 8 full and part-time doctors. They're all board certified emergency medicine, and they're all actually specialty trained in critical care and have worked in an ICU setting. We have 8 total patient beds, which we can use for surge capacity if there are hospital beds that are running low in town, and so we are completely prepared to do that. Our nurses are also, we made them take a ventilator training course so that if we do need to manage critical care patients, that they have the capacity to do that as well. So that we've kind of partnered with not just hospitals locally in the community, but also partners within the county. And we know that we have a smaller capacity to handle patients, but should there be a surge, we wanted to kind of create a network of places so that we can kind of allocate where the resources are. For instance, there's going to be towns with hospital beds that have, less cases of COVID. And so if we know where towns are around the clock, we can kind of place patients where they need to be placed. For instance, if I have an ICU patient and UCHealth's down to their last bed, I'm going to have a map to be able to see, okay, Fort Collins has this many beds, Denver has this many beds, and then we'll try to allocate those patients there, as well as teaming up with the other facilities in the area, giving them that information, and also giving them our information and kind of teaming up and saying, hey, if you have an inpatient that possibly doesn't need a ventilator, maybe we can save a bed and transfer them over here, and we can either try to transfer them out or manage them there, depending on how critical they are. So one other thing is that we're participating in the, there's a kind of a website log of how much PPE equipment is available. And so we're constantly updating that. And so we can see kind of around the area which hospitals have PPE. If we can send PPE to places that are lower, help them allocate. We're going to go ahead and do that. And I'm actually personally helping to allocate personal protective equipment, especially masks, to all hospitals around the country right now. I'm working directly with the U.S. government on that. And I'm literally, when I'm not working in the hospital, I'm probably on the phone 24/7 trying to get products to people that need it fast. And so that's another resource that I can bring to our communities to help to kind of get those resources once we start running low. I have established some pretty good contacts for that. So I'll cut short since you said no long-winded answer. I'll do my best, but I do tend to talk a lot. Sorry.
Okay, thank you. Next, and Chuck, you kind of got into this, but we want to kind of start with the obvious question. Does Routt County have a plan for a possible surge?
Yes, we do. We've been working. Again, we have many people in the EOC working with the hospital and other community members, including the emergency center, to come up with a plan to assist and figure out a way to help assist the hospital in decompressing, like I said before. So right now we've been looking at facilities that we could utilize to do that. We've been putting together, all the needs of those facilities. And so we've identified the community center and the ice rink as our primary facilities. We anticipate that if this does occur, the patients that would be moved would still require a little bit of monitoring, a little bit of supplemental oxygen before they are released to home or to another level of facility. And so, Dr. Kempers has been critical in providing medical oversight for that as well. But we do have that plan in place. We've been using guidance from the State Emergency Operations Center to help us dial kind of the need and the way that the state and even federally local governments have been handling that surge. So yeah, the short answer is we do have a plan in place.
Thank you. Jennifer, would you add to that anything about Route County's plan?
Well, I think that the biggest part of this plan is communication amongst the different resources we have available. And I've been very impressed at the teamwork and everybody pitching in as to how this may happen, because it is very scary, a lot of what ifs and unknowns. And so I really appreciate the county's input and everybody else's input as to what facilities and who can help where. So it's been an amazing effort.
And you mentioned that, so as the county looks to prepare for a potential surge, what other agencies, you talked about partnership and collaboration, what agencies are coming together to prepare?
So of course the hospital is one of the biggest agencies, because they're going to give us the go-ahead as to when we might need these alternative care sites. Also being in very close contact with Casey's Pond, which holds our skilled nursing facility and assisted living facility. Right now, they are not able to take new COVID positive patients due to state regulations and trying to prevent the spread. So that makes it become much more crucial that we have other avenues of where these patients could go. The hospital is in communication with Denver area and Fort Collins area and triaging more critical patients that direction to the specialists. And then we would be involved in triaging less critical patients to maybe alternative care sites, to the Steamboat ER. Are there other organizations that can help out in taking care of patients that may still need some medical help but are less critical?
I'd like to add to that too, Lisa. The county, Route County, has been a tremendous partner and really the facilitator for this through the Office of Emergency Management with Mo DeMorat, his leadership through that Emergency Operations Center, with direction from the policy group, which includes, like I said, stakeholders from all county governments in the county and municipal governments in the county, but also then individuals from every department have been stepping up and really playing a role. So, I mean, the participation, not only with the surge plan, but with this whole emergency response has been countywide and really almost too much to mention. And as I said, we have also reached out to the Steamboat Emergency Center and talked to them about guidance and some how they'll play in this whole role as well. So it really has been a tremendous amount of people coming together, as Steamboat does in any situation like this.
Thank you, Chuck. Sonia, so specifically, how is the hospital preparing for a possible surge? And maybe it might be helpful too we've begun using terms now like flattening the curve and surge. So maybe explain what a surge means and how the hospital's preparing, if you can. Thank you.
Yeah, sure. So I think first, it's important to share that as part of normal hospital operations, on an annual basis, we focus on multiple exercises to practice preparation for a variety of possible situations, and including a pandemic, and that's what we're in today. So a surge would be anything that exceeds, where it exceeds your normal census, your normal operations in any capacity. So it could be beds, it could be staff, it could be equipment. And that's what we focus on when we are exercising on an annual basis. We rely on those exercises to identify opportunities for improvement so that when something does occur in real life, we're as prepared as we can be. So specifically, more so over the past several weeks, we've been running the drills on the surge capacity plans that we have developed in our intensive care unit, our inpatient unit, emergency department, and operating rooms. And that has been very valuable to get the staff feedback, the ones that are going to be really running through the surge capacity plans on a real life basis to look for those gaps and opportunities for improvement. So what we do is we evaluate everything. Like I said, we evaluate staffing levels, equipment, bed counts, what also we keep an eye on what other communities and other states have experienced. And so where are we and compared to those other states and what we might be expecting in the next several weeks or what might be coming our way. So there's a long list of topics that we discuss in anticipation, before, during, and after a surge. So what we do is we proactively manage our capacity and free up the inpatient beds where possible to make sure that we're able to handle that large number of patients should it be needed. About a month ago, we took the stance of identifying surgeries and procedures that could be postponed without an adverse effect to our patients, while still providing urgent and emergent surgeries for those in need. And that really does help us, one, minimize encourage the distancing, minimize the number of patients within the facility, but then also to conserve the personal protective equipment, otherwise known as PPE, that you'll probably hear us talking about during this call, to ensure that it is available based on CDC and CDP guidelines should that surge of patients occur. So, and also throughout the UCHealth system, as Dr. Kempers alluded to, we do have a capacity and understanding what census is across the system. And so we've now cared for hundreds of patients with COVID-19. And we've seen that they often need ICU care and ventilators. And so we're closely watching those particular resources. We do have the ability to transfer patients to these locations if needed. As a system, we monitor our census across the entire region as well as the system multiple times a day. We look at it in a way of kind of a one bed ahead. How will we provide that optimal care, and where will we put that patient that comes in next? And so in preparation, just some examples of what we've done so far. We've erected a triage tent outside of our emergency department. The tent is intended to be used to rapidly assess, screen, and determine next steps for care for patients who self-present with the moderate upper respiratory system symptoms, bad coughing, concerns related to COVID-19. What it allows us to do is deliver emergency care still in the hospital, continuing to distance potentially infectious patients from each other, and ensure that we're limiting that potential of viral spread. We have not operationalized that fast track tent yet, because we haven't seen the surge that would trigger that. Additionally, just a few more things. We're fortunate to have the highly educated and experienced care team here in Steamboat. I think we all know that we have a community full of amazing talent, and that is also in our healthcare setting. We have high quality and talent and skill sets. And so what our care providers have been doing the last several weeks as well are refreshing their skills in areas, we do skills labs, and they're refreshing skills in areas such as vent management, intubation, arterial lines, sedation drips, all those areas that we think that will be necessary if we see that influx of patients. And then finally, I think Dr. Kempers and Chuck hit on this, is we're really, collaborating with the Routt County Emergency Operations Center, all of the healthcare entities in the communities here locally, as well as surrounding and within the state, to ensure that we're doing this in a collaborative manner and what we can anticipate. We also rely on our Colorado Hospital Association to share information as to what's happening in these other states and what might we expect in the next coming weeks. And so, with that alternate care sites, what we've learned is some of the states, the gaps that they found were in these interim treatment facilities. So once the patient does no longer needs acute care, but it's too soon for them to transition to a skilled nursing facility or rehab facility, we need to fill that gap. And that's what I think will play into factor with the alternate care sites that will be really helpful.
Thank you so much, Sonia. Jesse, how is Steamboat Emergency Center preparing for a possible surge?
So, good question. One of the things that I studied back in college was epidemiology, and I actually wrote a paper on virology. And one of the things in pandemics is you kind of got to look at the numbers, and you got to look at the environments that the pandemics are occurring. Now, if you look at New York and you plot their graph, and you look at Steamboats, it's going to be a completely different graph. And so what we need to do first and foremost is kind of trend that graph. It's difficult to do so because we haven't had the testing capability that we would need in order to do so, but we're kind of following those numbers. Why are those numbers important? Because what's happening in some cities we may not happen to other cities like ours, for weeks. And so those numbers become important because once we see that the potential for the hospital surge, now the hospital surge occurs not when people get COVID, it's when too many people get COVID at the same time. Okay, that's when the hospital surges occur. So, I mean, if everyone were to get COVID very slowly and then beat it 14 days later, we wouldn't get a hospital surge because everybody would be getting it kind of in a timely, systematic fashion. Unfortunately, because of the reproducibility of COVID, if a more populated town has an exposure, it's going to grow exponentially. So for every one person, it infects about 2.5 people if you're practicing social distancing and hand washing and all that stuff. So what we're doing is we're watching the numbers and I'm watching them every day, and we meet every day and we say, okay, look, here's where the graph is right now. So now here's what we're going to do. Right now, we feel like we have this many ventilators in town, this many beds. Right now, the beds aren't being occupied. But once I see that trend is starting to happen, I'm going to start mobilizing resources. Do we need more equipment? Do we need to get more ventilators? I'm emergency credentialed at other hospitals. Let's say, for instance, a hospital doesn't, one of the most important things about beating this thing is we need to protect our staff. If our staff goes down during a hospital surge, we're in trouble, okay? So we have now are requiring all our nurses and doctors to be on backup call because if one of them goes down, we cannot afford to have medical personnel going down during a hospital surge. So that's one thing that we've done. We've prepared a backup call schedule, and we've been asked by other facilities as well if we'd be able to be on backup for them, and we gladly said that we would do so. And so just mobilizing the resources and the backup resources to make sure that the care system does not fold during the surge is just as important as preparing for the surge. And then obviously we looked at converting other parts of the hospital to areas to hold patients, to kind of expand our capacity. Being that we're an ER, we can function as an inpatient facility. We have held patients for up to 72 hours, so we can take patients. We don't have the ventilator capacity of UC, but if they have some patients that they need to open up beds for, they can easily send them over there. We have qualified personnel for that, and then again, the network that I've constructed with all the other hospitals to try and figure out who's got more beds to spare. We want to kind of spread the wealth, so to speak. I mean, I guess wealth is a bad metaphor, but spread the patient load as evenly as possible so no one hospital gets overloaded. And so that may mean that patients come to us. Let's just say, for instance, we've had it under, we have this thing under control because we are kind of an isolated town that's practicing social distancing and our numbers aren't that bad. We may be on deck to help these other places out. And so, we've got to be ready for that as well. So those are all things that I think stem from just learning the pattern of the virus, learning how the virus is affecting this town, and then preparing as the virus starts to ramp up. That's going to come when we can test, because it's near impossible to beat an invisible enemy. And right now, this enemy is invisible because we don't have enough testing. The testing is going to roll out very soon. We're going to map those data points. We're going to light this enemy up like a Christmas tree, and then we're going to be able to contact isolate, contact trace, and we're going to beat this thing. So we're confident. We've got everything in place, and of course that PPE pipeline to make sure that if we do see that ramp up, that we're going to start ordering and having PPE available, because again, we have to protect our healthcare workers. Otherwise, that's going to be another problem.
Thank you very much, Jesse. Chuck, this question is for you, and you mentioned it, but maybe a little more detail. Once the hospital reaches capacity, where do patients go, according to the emergency plan?
Yeah, so through the EOC and the surge, and one partnership I didn't mention specifically, but I think probably everyone realizes, of course, there are large partners, the city of Steamboat Springs. They've been very gracious in offering up a handful of facilities for us to evaluate and look at. And so we landed on the community center and the ice rink as being the primary facilities that we would would utilize, again, if the hospital needed to decompress a little bit and move some patients out, to move other patients in. And so those patients would initially be split up between COVID positive or suspected COVID positive patients. And then understanding that, of course, the hospital will be dealing with patients that might not be suspected of COVID, their normal operation. And so we might have some that are testing negative or suspected to be negative, and we would move over to a different facility to keep those folks isolated. We've then, I'm saving my tier discussion for your later question, as I see they have, but we would then, as those patients continue to step down or become better and better, we have partnerships with the Holiday Inn and some of the other hotels here in town to then be able to locate some patients that might be ambulatory and doing very well on their own, need very little medical oversight, if any at all, but just can't go home to their home environment yet, whether that's Casey's Pond, as Dr. Kempers had alluded to, or even they have a high-risk parent or family member at home and they haven't had the full clearance to be negative and deem it safe to go home. So we've partnered with some of those facilities to allow those patients to spend some time there. And then the city has also offered up the tennis bubble, and we have that in the agreement as well. Again, just as another facility identified that we could utilize if this went in a direction even further than what we're anticipating.
Thank you, Chuck. Let's move a little bit into, it seems like testing remains kind of a big question for people. So let's start with Sonia. Why can't people who think they have COVID-19 be tested? And then kind of a secondary question is, do you think testing will ramp up anytime soon?
Yeah, so right now, as of now, and this has honestly changed constantly. I've kind of phrased it as every day feels like a week and every week feels like a month because of the amount of information that is shared during those times. So right now, testing of asymptomatic patient or people and most patients with symptoms that do not require hospitalization is not recommended at this time. And I know that there's a lot of, there's a lot of thoughts and perceptions on mass testing and that sort of thing that I think public health can speak to best. However, we have fluctuated with our testing criteria, and a lot of that has to do with really the access to testing supplies. And that's where we've had to prioritize our testing criteria based on the limited supplies that we're seeing today. And so it is hard for me to answer today as to, do I see it expanding even more without really understanding the supply chain aspect of what we can anticipate in the next few months. So, given the community transmission, as well as everyone has noted, Routt County does sit in a positive situation as of now. And in addition to the limited testing capacity, the current recommendation is only to perform testing when it will impact clinical care. So for most patients with COVID-19, having a positive test result doesn't, for everyone, change their medical care, because there aren't yet any proven treatments, especially for people outside of the hospital. So there are tiers in testing, and right now we are focused on tier 1. However, soon we will be opening that up to tier 2 patients as well from a testing perspective. And so that's exciting, but it does change, and it fluctuates based on, again, the access to supplies and the resources we have. But two great things that we have been able to put into place in the last several weeks is that UCHealth internally has capabilities to turn test results in approximately 24 hours. So that is a significant improvement from when we started testing initially. And then additionally, just this week here locally, YVMC is now able to provide rapid testing results that can be as quick as 15 minutes. These tests are really intended for the critically ill, the ones that we're looking at potential admission through the emergency department and or current inpatients, whether in our ICU or on our inpatient unit, that we feel are critically ill, and that fast turnaround diagnosis will really impact the type of care delivered to them. And so that's really exciting to have access to both within the UCHealth system, but then also here locally at YVMC to be able to really respond to our patients as they're here for critical care.
Thank you. Jennifer, would you add anything about testing?
Yeah, testing has been a huge frustration, I think, and it's a frustration amongst our patients. But also, as Sonia said, the guidelines when we first entered this changed rapidly. Literally every other day, we got a different update from the health department, and the hospital has also followed those guidelines pretty precisely as to who we can test, where the tests go. It has really improved with UCHealth being able to do the tests in the 24-hour turnaround. Just anecdotally, I had 2 patients who were, some of the first ones tested. It took us 2 weeks to get those tests back. That's not very helpful. So it's improving every day. And like Sonia said, we are adding the more at-risk patients back to testing, the immunocompromised people who it may make a difference whether or not they are positive or negative. I think the good news is, like Sonia said, that most people, besides the fact that they need to be isolating and staying away from loved ones when they are sick, it's not going to make a difference in their clinical care as to whether they're tested or not. And that is from the primary care standpoint. We've done a lot of coaching, pep talks, self-isolation, all very important. Whether you have the COVID-19 or some other medical infectious illness, stay away from others. If we can keep everybody well, whether it's from COVID-19 or something else, it'll relieve the pressure on the health system. So it's been an issue. It's getting better, and I see it ramping up every day.
Thank you, Jennifer. Jesse, would you like to add your thoughts about testing and some of the frustrations and whether or not you expect it to increase?
Yeah, I think the testing system around the nation has been very frustrating for healthcare workers. The testing guidelines are not designed more or less for a medical purpose, but kind of designed around the fact that we just don't have enough tests available. And now we've been weeks into this, and I'm still seeing not enough tests available. This is concerning. Okay, it's one thing to do test inpatient. That's fine. You're getting treated for COVID. You're an inpatient. But 70% of this disease is being spread by people who are minimally symptomatic or asymptomatic, and we don't have the ability to test them. That's a problem, because without testing, we're not going to be able to control this thing. South Korea managed this in an exemplary fashion, and the way they did it was early and often testing. Why is that important? Everyone's talking about we need treatments, we need a vaccine. Vaccine isn't coming for 8 months to a year, you guys, and any kind of treatment is not going to get through clinical trials for 3 to 6 months. So how do we beat this thing? It's with testing. We need more testing. We need to be able to test as many people as possible, because what that allows us to do is that allows us to take somebody who's positive and do something called contact tracing, where we can go back and see where they've been and who they've contacted, and then start to test those people to identify the asymptomatics. It's the asymptomatics that are going to help us to stop this thing, because those are the people that don't know they have it, and so probably aren't taking contact isolation as seriously as everybody else. But if we can identify and map those people, we can contain this much better. So again, we're doing what we can with the resources we have. And obviously, we're saving the test for healthcare workers, because, as I said before, healthcare workers need to be protected. Otherwise, any hospital surge is going to be, 10 times worse when we have a limited staff and staff shortages. But I'm finding the testing situation frustrating. I know there's new tests coming out. There's a rapid test, a point of care test that's, they're saying about 73 to 80% sensitive. I know for a fact that this viral transport medium tests are almost 99.6% effective. We need to get these kits out here. I mean, if we get these kits out here, I think it's probably the strongest weapon we can have in order to beat this thing. But with the limited testing that we have, if that doesn't ramp up soon, then we're going to be in for a big surprise. And I think it's an essential weapon. We need to kind of lobby and figure out how we can get these kits. I'm trying to source them. It's very difficult. They're sold out everywhere. Every hospital, as you can see, needs them. So for the meantime, the plan we have is it's not the greatest plan, but it's the best plan that we have with the resources we have. And so my hope is that that we can get a significant ability to test in the next few days, and I really think we can make a difference. And being in Steamboat, and we're not as worse as places like New York City, it's still very important to test because we have a window where we can actually isolate. Let's say if only 8% or 7% or 0.7% of our population is affected, we can actually isolate those people and beat this thing much quicker than any other community. And so they need to get us those tests. And so I think that is very important, and that's going to be the next weapon that we have to end this pandemic.
Thank you, Jesse. Chuck, you touched on this, but we know the medical community first responders. Sorry, my. Hello. Oh gosh. So the beauties of Zoom. There we go. We have a very we're very environmentally focused. My lights go off if I don't move. So anyway, Chuck, we talk about triaging with first response and the medical community. And can you explain the different tiers of patients and how that is used when dealing with a health crisis?
I can certainly explain it from in my world. And I'll let some of the other folks jump in. But so in the first responder world, we triage typically in mass casualty situations, whether it's a trauma event, traumatic event, or even a very quick medical event. But we're typically triaging to decide kind of the direction patients are going into the healthcare system. During this event and during this surge planning, the state and medical communities have been using a triage system to identify the level of acuity with patients, and then we're sort of triaging them down on their way out. And so in this surge planning, the tier system that we've been using as kind of put out by the state is that the tier 1 are the critical patients, and they're the ones that require critical care in the hospital or emergency setting. And then as they start to get a little bit better, we're calling them acute patients, and they're being able to transfer to a tier 3 facility. The state and what most local municipalities or local agencies are trying to utilize for those are places like a standalone ER or an ambulatory surgery center or something that may be able to care for those tier 3 patients with a little bit more critical oversight. They're not ready they're still in beds, they're still requiring medical care. And that bigger cities have a lot more of those facilities than we do, obviously, in our area. So really, we, for our purposes, have been considering UCHealth as the tier 4 and tier 3 facility, or excuse me, tier 1 and 2 facility. As they move from tier 2 to tier 3, they're going from acute to subacute, and that's what we're looking at in our surge planning and alternative care facilities, are tier 3 facilities. So these are patients that maybe in normal operations, the hospital wouldn't be discharging yet. They'd just be holding on to them a little bit longer. But in this case, again, we're trying to help the hospital decompress, allow them to have beds for the more critical patients. And so we're going to be moving those tier 2 to tier 3 in our alternative facilities. And then really the final step down in this case is from tier 3 to tier 4, which is really more of an ambulatory patient that doesn't need much medical care at all, if any, but just isn't quite ready to get back into their normal life and their normal home. And so that's how we're using those tier designations in this case.
Thanks, Chuck. That's really good information. Sonia, back to you and Jesse, but we'll start with Sonia. People are concerned about capacity. So could you provide some detail on what is the current capacity at the hospital? You know, beds, ventilators, all of that.
Yeah. So as part of the UCHealth family, we're able to flex these inventories, and that even goes with beds, ventilators, and PPE to support patient care and keep our patients, staff, and providers as safe as possible. So that's great access to have, and we can flex based on that. So YVMC is known as a 39-bed hospital. That is what we're licensed for. But during a crisis time like this, we're able to shift that allocated number of beds as needed to appropriately care for patients. So we're able to flex different rooms, different areas, again, as long as it allows for safe patient care, to fill the void or the need on the gaps that we might experience because of an influx or a surge. So an example of that, we have an inpatient unit that includes our intensive care unit. And within that inpatient care unit, we are able to convert an entire wing if needed to add additional beds and provide that intensive care that isn't provided in those areas today, but we're able to convert those inpatient beds into ICU beds if needed. We right now can readily access about 10 ventilators, and we have plans to support more than 10 patients if additional breathing support is needed. Again, I go back to whether it's inventories within the system, we're looking at that every day. We're looking at how we can offload patients to the rate to just to spread out that demand that hospitals will be seeing, and so that we have the appropriate equipment and staffing levels. We have also worked with transport partners. If we do need to transport patients out of the valley, how does that work? Whether it's ground or air, we have plans in place should that patient need to transfer to a different facility of care, just as we have in the past, but now it's a different situation, and we need to make sure that those transport carriers are ready to transport in what types of patients and in what manner, so that, again, that it is a safe transport. But beyond these tangible capacities that we have, I think what's really important to share is that we have the qualified individuals. We have a whole care team that consists of all the different skill sets that's required in a critical care situation. So examples of that would be, the critical care nurses, the respiratory therapists, infection preventionists, so experts who this is what they do. They focus on infection prevention. We have hospitalists, so providers that are focused on inpatient hospital care. And we have the technology. So an example of one of the recent technologies that we've implemented is called virtual ICU. And this is an additional support on top of the caregivers and the providers that we already have monitoring our patients. It allows us to have additional sets of eyes on our critically ill patients using state-of-the-art equipment and analytics, looking at all the numbers on an ongoing, consistent basis to then essentially ensure that we can optimize those patients' outcomes. This also allows our bedside staff to do more for these patients when we have extra sets of eyes looking at all the data and the analytics of what's going on with those patients.
Thank you. Jesse, how about the capacity and capabilities of Steamboat ER?
So right now we have the ability to vent 2 critical patients at a time. But being that we're a freestanding emergency room, our goal is going to be more the stabilization of patient and then allocating them to the area where they have the most capacity to handle that patient. And so that's kind of the crux of our plan. Our doctors are more than capable of taking care of patient, overnight. However, we want to keep our beds open so that we can kind of turn over patients and then kind of put them in facilities. Let's say we call over to UCHealth and they say, hey, our ICU beds are full. I can call to multiple hospitals around the area. And let's just say, for instance, Fort Collins says, hey, we're only at the 30 or 50% capacity. So I think it's important for us to kind of make sure that we allocate and not flood one area with particular patients. And so we kind of serve as I believe in this battle as more of a an overflow for patients that aren't as sick, although we do have the capability to take care of them. Once they do get sick, then we efficiently transport them to the place where they need to go that can handle them and not be overwhelmed by having additional patients. And so that's why it's important for us to manage and keep track of not just the resources that we have in our immediate vicinity, but also all the resources in the state as a whole, so that we can make sure that we can get the patients to where they need to go. I'll tell you guys firsthand, I intubated 2 COVID patients about 48 hours ago. I'm on emergency call for hospitals in Florida, and they had patients that they had doctors that came down with COVID, and so I had to go in there. And this disease rapidly progresses. I mean, you can have someone talking on their cell phone to you, and within 6 hours you're intubating them, and within a day they're in ARDS and they're about to die. Now we have to be able to recognize who those patients are, because in this town we have certain things. We have certain we lack certain types of care. We don't have ECMO. We don't have proning beds. When patients start to get sick, our doctors need to be able to recognize this quickly and move them to a place of higher care instead of trying to manage them here. Because again, these patients, especially immune compromised, they're going to go down very quickly. And if we don't make that decision to get them to a higher level of care quickly, that's going to be the difference between life and death. And so those are things that we gotta take a look at and make sure that our doctors know how to recognize when these patients are going to go get bad, and which ones can be managed here safely. And so so that's another thing, just kind of knowing where we need to go if we do get a bad ARDS patient that may need an actual live intensivists and some other equipment that we don't have here. And so that's something that we are constantly kind of training our staff to recognize. And so again, we want to serve as kind of a place where we can recognize and categorize patients. And obviously, we do not plan to hold ICU patients if we don't have to, but more or less allocate them to places where they can be accommodated without overwhelming that particular facility. So,
thank you, Jesse. Next, this question I think would be for Jennifer and Chuck. Jennifer, is the county looking for volunteers with medical training or who have worked in the healthcare profession in the past to help? We hear other communities that are inviting. I know the governor has worked on this. How are we in that situation where you all are looking for?
Well, we started a list. We're not in that situation here in Routt County where we crucially need volunteers. However, people have stepped up and volunteered, and so we have started a list with contacts. I would encourage any physicians in the county, if they are interested in participating in these alternative care sites, if need be, to contact my office, which is Yampa Valley Medical Associates, and leave their name and number, and I can reach out to them. And I know Chuck has some contact information for any nursing, physical therapists, nurses' aides. Chuck?
As Dr. Kempers referenced, again, through the EOC, the tremendous work they've been doing. They have a person that's compiling a list of volunteers. And we say volunteers in the sense that they're raising their hands and saying they want to help out. We're still working on the specifics of how the staffing would be applied and roll out in these alternative care facilities. But the best place for people to go is to the county COVID site, which is COVID-19 routtcounty.com, and that's been out there in many places. There's a link to the volunteer if you want to volunteer, and then they'll reach out to you and get your specific information and how you can help. And the tough thing for all of us at this point is we just don't know where this is going, when, if anything is going to truly hit, and how hard it's going to hit. And so a lot of what we're doing right now is preparation and waiting and seeing. And so we appreciate the community support in that aspect, and we're still compiling as much information we can about everybody that's available and trying to get ourselves ready.
Thank you. Something else that's very top of mind with readers and people in the community, they want to know how our frontline medical workers and first responders are holding up. Do they have what they need to protect themselves? And then maybe a secondary question is, how can the community support these frontline workers? So Sonia, would you like to address that first? Because I think I'd want to ask each of you about this.
Yeah. So, I mean, I'll just start off by saying I've never been so amazed and proud of our staff and providers. The care that they provide to our patients every day is inspiring, and especially during difficult times like this. Not to mention, our staff continue to do the work that they do, and they do well, but they're also dealing with this just as much as any other community member, whether it's a spouse out of work, children at home, managing homeschooling and virtual classrooms, but then still coming here on a daily basis to take great care of our patients. So, while I've said this before, many people are afraid and unsure how to react, but our staff, they run towards the preparations. They are running towards additional training and education and ensuring that they have, they're trained up on all the necessary PPE and the changes that are occurring there, and how to be more prepared and ready to take care of our patients. We actually have staff too that are interested, because we haven't seen the influx just yet, that are interested in going and supporting these patients at other UCHealth facilities. It allows them for experience, but then also just, this is what they do. They want to take care of them. So they're running towards this pandemic, while many of us are running away from it. So I think that, it is such a great responsibility that our staff have, and we're honored to deliver this care to our community. Of course, we are always concerned, as we are for the entire nation, of just everyone's well-being through this. And so we have a lot of emotional support and well-being resources. We have licensed professionals who actually round on our staff on a daily basis. We ensure that we're putting out those access to resources out to our staff continually, so they know to access that. We are really ensuring that that is our top of mind, is their well-being, and then also ensuring that they are safe while they're providing care here. That's definitely our priority and our focus.
Thank you. Jesse, how about you? How do you think the frontline medical workers are holding up?
I'll be honest with you, as an emergency physician, this is what I've signed up for. I've seen, I've been to 9/11, I've been to Haiti earthquake. This is what we do. And so to us, it's work. We train for this. And just like our soldiers go out and fight and defend this country, this is what our healthcare workers do when these type of things happen. And so we're proud to go out there and do what we were trained to do, and offer our skill set to help the nation get through this. This is kind of, I don't know what a good metaphor. Maybe this is kind of our Iraq, So we're going in and we're doing what we need to do, and I think everybody's proud to be of service to the nation in any way that we can, and so I think the spirits are high right now. In other places I can't speak for it. I've got friends that work in New York. I've got friends that are in New Orleans, and the situation is pretty grim. They've lost facility members there, and so this is the kind of stuff that we've been training for, the kind of stuff that we're ready for, and obviously everybody in this medical community is supporting each other. I'm flying out to help where I can, so that hospital systems can stay open and properly staffed. And I just think that the team effort is just kind of everyone just wanting to help everybody else, whether it be sending updated resources through a chat group, or people asking questions to me over a chat group because they hadn't seen certain things. I think that together, that camaraderie, is just keeping the morale high, that you always have support. If a family member passes away, we're quick to get their shifts filled, and no questions asked, no complaining. Everybody's just stepping up and and really and taking this thing on as a team. And I think the effort so far has been heroic.
Thank you so much. Jennifer, what would you add?
Well, I feel like here in Routt County that most of us are holding up pretty well. I think that certainly we've had to become more flexible, wear different hats, think outside of the box. And I would agree with Sonia that the hospital team has really stepped up. My office staff has really stepped up, and I've been really proud of the county and the first responders and everybody. And also, it, you know, as I think Chuck said, as Steamboat usually does, we are supporting each other. And so we've had offers of N95 masks from construction teams. We've had people send us lunch as a token of their appreciation, thank yous. Last night, apparently the community had a response at 8 o'clock. What was it called, Lisa?
It's called Clap for our Carers.
Yes.
Yes.
And it really, the community rising above this and everybody doing their part helps us as the front line to know that we're appreciated. And so right now we're doing okay.
Thank you. So good to know. Chuck, how about the first responders, those that are, what can you tell us about how you guys are holding up?
You know, I'd echo everything everyone else said. We have an incredible system here, and the healthcare workers in general are incredible in stepping up to the task. Specifically with the fire department and in Steamboat Springs, I would say the same. We are fortunate enough to have one of the best fire departments I've ever seen, and our folks are doing the same. They're diving in, they're learning what's different in this situation than others that they've seen, learning how to deal with it, making sure that we are prepared when we respond to people's homes. We do have the PPE that we need right now, and through the EOC and through coordination of all the partnerships in the county, the EOC is trying to ensure that everybody, all healthcare providers, everyone that needs proper PPE has it. And so we're sharing with each other. And again, I think it's an incredible a show of force that we have here. We are not in the situation that New York City and other places around the country are in yet. And so I think a lot of our folks are preparing, and if we do see ourselves in that situation, we're ready to go. And the first responders are no different. All of the Routt County fire agencies are tapping into the EOC. We're talking to each other. So every fire district in the county is in the same situation. Their providers are ready to go. They know how to handle the situations when they show up to people's homes, and I have no doubt that we'll get through this as best we can.
Thank you. We could probably go on for another hour, but it has been an hour, and I know you guys are busy people, so we want to let you get back to doing your important work. But I do want to end with giving you all an opportunity to say something in closing that maybe we didn't touch upon or that you want the community to know. So Jesse, let's start with you. What would be kind of your final thoughts for our audience?
My final thoughts are, one thing people have been coming to me about is, hey, we're not so bad in Steamboat. Do we really have anything to worry about? And I tell them, we have to understand that there's still a lot of uncertainty out there, and it's better to be over-prepared and wrong than under-prepared and right. So, there's much over-preparation. And so people think that, hey, we're going a little overboard with this, aren't we? We don't have it so bad here. Our numbers aren't that bad. Then that's all the better. It's going to make it easier for us out of here. But let's just hope we're wrong. Let's hope that Steamboat's isolated enough that that this won't be a major issue. But we can't just assume that that's the case just because of what we're seeing early on. We got to assume that this could potentially be as bad as some of the other places. And so one last thing I want to say is on my social media and emails, you know, I think it was recently, it was National Doctors Day, and people were saying, hey, thank you for being a hero. And make it clear, anybody who's helping to stop this, anybody who's doing social distancing, who's washing their hands, who's educating people about coronavirus, you guys are all heroes too, okay? So we're all heroes. So it's not just the healthcare workers, it's the entire community. So I just implore everybody, everybody in the community, everybody in the world, let's be the heroes that we need to be right now so that we can come together as a team and beat this thing.
Thank you so much. Jennifer, what would you like to say in closing?
Well, first of all, I think I've already expressed this, but thank you to everyone involved, to the hospital, to UCHealth, to the Steamboat Emergency Room, to Casey's Pond, you know, everybody, the county, the firefighters, EMS, everybody is doing their job to pitch in. And I think that's truly important. And that's how we're going to beat this thing. The other thing I would like to implore, some of our numbers are looking good. Maybe we don't have it as bad as we thought. And I would encourage everyone to silently celebrate that. Maybe we won't need all of these surges that we have prepared for, but people are starting to get bored in their houses. The sun is shining. The kids are going stir crazy. We're stressed. Take care of yourselves. Continue the social distancing, continue the hand washing. The numbers are starting to look like we are flattening the curve, but we need to not let up and continue all of those things that I feel like our community has done on a whole very well. So thank you, everybody.
Thank you, Jennifer. Chuck, what would you like to say in closing?
Ditto. You know, really, I completely agree. I think it's better to be prepared and ready for what might come, and that's what we're doing. But I also agree that we are too early on to make that call yet. And so the experts are not ready to make that call. So as individual community members, I think we need to follow their lead, and that is to continue to prepare, to continue to have diligence. And that's the word I've been saying time and time again is we're not through this yet. And so I do understand the need to get outside and to want to try to go to, you know, all the places that we're used to going to without a second thought. But we need to be diligent still. This is the time. This is our time to step up. For a lot of us, well, for all of us, we've never seen anything like this before. And for a lot of us, this is one of the biggest events we'll see. And so I've been really trying to emphasize with my crew that now is the time. Now is the time for us to step up and do what we need to do to get through this. And we will, but we need to have diligence and keep persevering through this. And so I appreciate every effort that everybody's made, moms, dads, family members, healthcare workers, everyone. And we're doing it as a team. And I couldn't be more proud of our community right now.
Thank you, Chuck. Sonia, what would you like to close with?
Yeah, I mean, same as Chuck. I echo everyone's sentiments and comments. I mean, yes, thank you to this entire community. This is times like this where you're just so, you know, I just so appreciate being part of a community like ours. You know, I want to share that we've been overwhelmed with the community's support and generosity through this time. As Dr. Kempers mentioned, I mean, we've been flooded with, opportunities for meals and supplies and grocery deliveries and things that really do make a difference for our caregivers. So thank you to our community for that support. I too want to continue to encourage everyone to participate or to practice their social distancing. We need to take these orders seriously. This is the best way for us to slow that community spread and save lives, essentially. And I do agree that because of where we're at with our current situation, that people might get a little lax on those. And I really want to stress the importance of that. In addition to that, though, as Dr. Kempers mentioned as well, it does affect everyone's mental well-being. And so do whatever you can to stay socially connected to those that you love and care for. That's really important and goes a long way. And I know sometimes can feel like something that you can pass on or wait until some of these orders are lifted, but it really does make an impact. And ensuring everyone's positive well-being right now is very important, and in continuing that human connection. And then I do want to share as well is we do have a lot of tools available for support. So COVID-19 is one of many health issues that our patients can experience. So there are still a lot of other healthcare services that people are needing, and we don't want people to shy away from that at this time, even though we're in this pandemic. So we do have the Ask a Nurse hotline, as well as virtual urgent care visits. A lot of our providers have access to primary care visits as well. So if it's not urgent care and it's just a primary care well visit, whatever it is, we encourage everyone to continue to reach out to receive that level of care that's important for them, because we don't want that to be left behind. And we just want everyone to remember that we are still here for you in whatever it is that you need. We are going to provide high quality care, whether it's COVID related or not. And we're here to take care of our entire community during these times, as well as any other time.
Thank you so much. So that brings this town hall to a close, and I really thank each one of you that participated this morning. I know this entire community appreciates the work that you are doing to keep us safe. So thank you. Next week, we will have 2 more town halls. We will be actually having one that's maybe a little more lighthearted. We are going to be talking to various leaders of organizations that are creatively providing stay-at-home activities so that they can still be active, but they can do that at home. And then we will also be having a panel with our school officials. And so that will be good as well. So again, please keep sending your questions. You can send them to covid@steamboatsprings.net or to news@steamboatpilot.com. And again, at the end of each of these, I'm always very impressed with the solidarity and collaboration that we have here in Steamboat Springs and Routt County. So again, thank you all. And please, everyone, stay at home, practice social distancing, wear your mask, and we will get through this sooner than later. So thank you all. Have a